Hi, this is Dr. Thomas Lin. Today we're talking about dermal fillers. So, a lot of patients ask me, I want to age gracefully. So, this aesthetic treatment plan can be effectively accomplished with the use of dermal fillers. So, we are all subject to the effects of gravity, and so everything pulls down. So, with time, everything sags and becomes a little bit more down looking. And of course, as we age, we lose our volume in our face, not just from the bony structures, but also connective tissue, as well as fat pads that we lose in the face. So these connective tissue is what we refer to as collagen, and as well as hyaluronic acid. So hyaluronic acid is the active ingredient in fillers, and this is something that we can provide for patients for volume and for lifting. So the fat pads of the face is somewhat important. It gives the apple of the face as well as the definition of a more youthful appearance. And however, as we age, we lose that apple of the face, we lose the fat pad, and everything sinks down. So then we start formation of this what's called nasolabial folds. So these are things that can be corrected with dermal fillers. Bone resorption is one of those things is quite common as people age, because the bony structures of the face started to have a recession, especially the maxilla, which is above the mouth here, and the jaw line sort of recedes, as well as the orbits of the eyes enlarge, and even the nares, the nasal bones enlarge in terms of the cavity. So things start to come out as a more hollowed appearance, hollow cheeks and hollow eyes, as well as more recession of the maxilla. So all these things added together gives a more saggy look and lines of the face. So these things can be corrected with dermal fillers. These connective tissues, obviously people previously have used collagen to replace, however that's used from a bovine source or from cows, and it has not been very long lasting and has not been quite useful. So now with the last 15 years or so, the hyaluronic acid is the most common filler, and it's been widely used all over the world and is quite effective. And this is hyaluronic acid fillers are produced by bacteria that is common to all vertebrates. So we're very common across species. So it's non-immunogenic. It draws water, and so it has more volume, volumizing effect. It's also made to have more cross-linking. Cross-linking meaning something like when you somebody perm your hair, that makes that strand able to cross-link each other and becomes more of a volumizing effect, and decreases degradation from your own body's enzymes. So that's basically what it does. It's like also a bowl of spaghetti in a sense. All these spaghetti noodles are cross-linked so that it becomes more of a volumizing instead of the individual strands. So this is what the manufacturer has devised to keep the dermal fillers in the body much longer, and avoiding the body's own process of degradation. There are thousands of fillers all over the world. However, we shall only concentrate and use the FDA approved ones. And I'd like to talk to you a little bit about the FDA approved fillers. So here we have just the three manufacturers that produce the dermal fillers in the United States. The big ones are Allergan, Galderma, and MERS. So they all produce these ones that are more softer for the areas of the face, like the lips, the tear trough that's very thin-skinned, as well as nasolabial folds, as well as perioral spaces here, because you want movement in those areas, so it has to have a soft filler. So versus the more structural fillers will be more of with volumizing effect. That is more of a thicker, more viscous filler. So for instance, Allergan makes this thing called Juvederm Ultra, and they're for a softer filler, and their structure filler is the Juvederm Voluma. And then Galderma also has the Restylane line. The Restylane Silk is the softer filler for the lips and the perioral areas, as well as the more structural support is the Restylane Lift. We have the MERS lines that have the Bellatero, and Bellatero can be used for the more of a softer, more forgiving appearance, more of a natural look in the lips and the tear trough and the perioral areas. And there are more structural filler is called Radiase, which is not a hyaluronic acid filler, but it's a foreign material called calcium hydroxyapatite. What these filler does is it draws water, but it's a synthetic material. It does make the collagen synthesis of the skin more readily available after the filler has been placed. So the placement of these fillers are more of a dermal, intradermal, or a subdermal area for the volumizing effect in the lips area and the softer areas of the tear troughs. But for instance, for structural support, these fillers are placed right on the bone to have a lifting effect for the volumizing effect on places where, like the cheeks and the temporal areas, as well as the jawline, for instance. The lips can be defined with the fillers, the soft fillers, to have a vermilion border definition. This is so that the lips has a more defined look, as well as the plumping effect by injecting right into the body of the lips for a more of a pouty look on the lips. So again, these things are just an introduction. See, the micro cannula is the new technology that the dermal fillers can be used to introduce it to the face. That allows for less of a complication risk for the patient, because micro cannulas are blunt instead of hypodermic needles that may tear up structures in the face like nerves and blood vessels. So micro cannulas can there to kind of go into the face and dissect tissue planes, but not able to tear up the blood vessels. So therefore, you do not have to risk anything about the blood vessel being hematomas, as well as intravascular injections, which would be very, very problematic. So we like to use the micro cannulas in our office to decrease that chance of hematomas as well as nerve injuries. PDO threads is another type of dermal filler, which is a foreign material that's like a Sculptra impregnated with these sutures. These sutures can be placed non-invasively in the face for volume as well as for lifting. So these things has been FDA approved and has been coined as the lunchtime facelift, because there's no downtime, and faces the deficits of the face can be defined with these things. So with the appropriate ATP implemented, with the volumizing dermal fillers, both of my patients and myself getting very satisfying results, and this is very gratifying, and because it's very instantaneous. Thank you very much.